Blumenfield. Hernandez. Lee. Lee, absent. Rahman. Here. Price.
Here.
4 members present and a quorum, Madam Chair.
Will you pardon me for one moment? I forgot to make an adjustment. My fault, my fault, my fault. Sir, would you mind?
You're good, you're good. Thank you so much.
You're all set.
Thank you. Wonderful, thank you. Members, today we have 2 discussion items on the agenda, and we're not ready to receive comments from the general public. This is a special meeting, so there will be no general public comment. Each speaker will have 1 minute per agenda item, so you have a total of 2 minutes should you choose to speak on both items. With that, would the speakers I call please come to the podium. Once you reach the microphone, please state your name and the item you wish to speak on. Thank you. My colleague will begin reading the names now. Thank you.
Carolina Goodman, Jason Enright, RD.
Thank you. Beautiful, thank you.
Hi, my name is Jason Enright. I'm from CD2. I'm also on the North Hollywood Northeast Neighborhood Council. Thank you, council members, for hosting another meeting on this topic so soon. First, item number 1, throughout my 2 years learning about unarmed crisis response, one thing I've heard from every level, city, county, and service providers, is that we do not have enough people to work these jobs. I strongly support the motion to learn more about how we can incentivize and create programs to train people for these jobs. I would just suggest too that in addition to training youth for these jobs, we train adults who are changing careers. There's a lot of turnover in things in industries now. If we could also create programs for adults who want to work in this field, that'd be great. Item number 2, the county has worked to lower response times over the last 2 years. But UMCR already has lower response times and helps support the county teams in the densest areas of the cities. It's very important we have both programs at the city and county level supporting each other. I also think there needs to be ways for the city and county teams to communicate so that whether someone calls DMH, 988, 911, or ask LAPD, that the closest and most readily available team is deployed. We need those programs to work together. Finally, this topic is very personal to me and families like mine. I want to reflect today on what happened to Yang Yang from Koreatown. His father called DMH to help, and the DMH clinician that was sent out determined on scene that they needed LAPD assistance. Although LAPD called for assistance from a SMART team, they chose not to wait for that mental health team and instead breached Yang Yang's residence, and he was shot to death. This was all ruled to be in policy by the police commission. I simply ask everyone here, if this is in policy, then we need to change policy. We need to make sure we're protecting people with mental health issues like my son, like Yang Yang, and that we create these citywide comprehensive services to do so. Thank you very much. Have a great day.
Thank you, Mr. Enright. Next up, Carolina Goodman.
Good afternoon, council members. I'm Carolina Goodman, and I'm a member of the LA Forward Unarmed Crisis Working Group. Regarding item number 1, we've been hearing for some time that we don't have enough trained crisis workers. Thank you for identifying ways to address this need. One of the main goals for LA Forward's Unarmed Crisis Response Working Group is to ensure that residents can expect highly qualified service providers. Yes, providing programming in community colleges is a great idea, as is workforce development. It would be important to advertise widely beyond traditional outlets to grassroots organizations as well. You may or may not know about a national resource, Transform 911, which has valuable information with regard to training. It goes without saying that providing professional unarmed crisis response teams will require salaries commensurate with their knowledge and expertise. Regarding item number 2, our working group has met with LA County about their Alternative Crisis Response FIT program, it's great that there are mental health clinicians and community health workers who can de-escalate crisis without needing law enforcement, use of force, arrest, or incarceration. Since 2017, 31% of people who were shot by LAPD were perceived to be experiencing a mental health crisis or illness, underscoring the need for unarmed crisis response. The county is pleased with reducing their response from 2 hours to their past average of 6.5 hours. We are advocating for $12 million line item in the city budget for UMCR, which has an average response time of 28 minutes. Since March of last year, over 7,000 calls have been diverted from LAPD to trained UMCR clinicians, and only 3% of those calls were referred back to police. Over 10,000 Angelenos were connected to vital emergency services without having to interact with police. Thank you.
Thank you, Ms. Goodman. Next up is RD.
My name is R.D. Pleshere. I'm a resident of CD1. Thank you. Item 1, crisis workers and teams need to be trained, and we need to recruit them, more of them. These teams are critical infrastructure relating to all Angelenos, not simply one specific population defined by age or experiencing homelessness or people suffering mental health crisis. We also need to make the public more aware of these programs, what they do, and how people can learn to work in these roles. Item 2, collaboration and communication are key to any endeavor. We need clear lines of communication for city and county teams to interact. We need the closest and most readily available team deployed. We need these programs to work together, not only for the caller, the recipient, yet for the budgets of both LA County and LA City. This includes DMH, 988, 911, Ask LAPD. Thank you for giving me a moment to breathe. And I believe that I have said everything I need to say. Thank you for listening to me.
Thank you so much for joining us today, for taking time out of your day to come and speak on such a critical item. Well, I'm going to go ahead and conclude public comment as there's no one else signed up. Now I'm going to turn this over to the co-chair of this committee, Councilmember Blumenfield, to talk us through the first item.
Thank you, Co-Chair Hernandez. Madam Clerk, would you please read the agenda item into the record?
Item 1 is consideration of a motion relative to instructing the Civil and Human Rights and Equity Department and the Youth Development Department to report on strategies and the steps necessary to co-sponsor workshops to increase education about pathways to becoming crisis workers for the city's outreach programs to individuals experiencing homelessness and unarmed crisis response teams.
Thank you. Colleagues, I introduced this motion to accompany another motion that I introduced last year in January of 24 with my co-chair, Ms. Hernandez, on strategies the city can adopt to strengthen our behavioral health workforce. The LA City Rights Department is putting on a similar event on April 19th for medical professionals. We know the behavioral health industry has experienced a shortage of clinicians, licensed social workers, nurse practitioners, psychiatrists, and this impacts both the city and the county's ability to bring on more staff for programs such as UMCR and the county's alternative crisis response teams and the other health, mental health, and SUD services that the county provides. The motion today helps advance the ball with tangible steps that we can take to not only support UMCR, but ultimately support the efforts of the county as they are the main providers of behavioral health services for the 88 cities within the county. The county is taking steps to offer incentives and actively recruiting for their programs, and this motion simply seeks to support that effort, and I ask for your aye vote. Ms. Hernandez, I believe you had an amendment.
Yes, thank you, Councilmember Blumenfield. And thank you for your work on this item. Thank you for allowing me to join you on this motion. I have two friendly amendments. One is technical, which is to change the first moving clause by adding the Economic Workforce Development Department as one of the departments reporting back. And then the second amendment adds two additional instructions, which are I further move that the Economic Workforce Development Department, with the assistance of the CAO, the Chief Administrative Officer, the Chief Legislative Analyst, and the Personnel Department, report back to us with an analysis of how other jurisdictions support education and workforce development for unarmed crisis response teams, including strategies to build career pipelines, promote community awareness, and sustain a qualified workforce, as well as ways to inform and strengthen the city's crisis and incident response through the community-led engagement circle program, unarmed model of crisis response UMCR program, and other similar co-deployment and county programs. The second amendment is I further move that the CAO collaborate with the County Department of Mental Health to identify opportunities for joint education and workforce development initiatives that directly support the recruitment, training, and placement of professionals into unarmed crisis response roles and ensure alignment across city and county efforts.
Great, and I accept those as friendly amendments. Colleagues, are there any comments or questions on the item or the amendments? Seeing none, I think we can move forward with a vote. Madam Clerk, will you please call the roll?
Blumenfield,
Blumenfield, aye.
Hernandez,
Yes.
Lee absent, Rahman,
Yes.
Price.
Yes.
4 ayes, this item is approved as amended.
Great. Now I want to turn it back over to Councilwoman Hernandez for to walk us through item number 2.
Thank you, Council Member. Thank you, Madam Clerk. Can you please read the item into the record?
Item 2 is a verbal report from representatives from the County of Los Angeles relative to an overview of LA County's alternate crisis response program, including statistics on their services within city boundaries and how they interact with city programs like Unarmed Model of Crisis Response and community-led engagement.
Thank you so much. We're joined by representatives from the County of Los Angeles. We have Mr. Wilson, who's the head of the ACR unit for the county, which is Alternate Crisis Response Unit. We have Ms. Jackson here with us today, the Deputy Director of Countywide Engagement, the Countywide Engagement Division, and Mr. Schultz, Chief of Policy and Strategy, and Mr. Handel, Chief Deputy Director. And please correct me if I messed up any of the names, but just again, grateful for you to be here with us today.
Good afternoon, council members.
Good afternoon.
My name is Ruben Wilson, representing the Department of Mental Health. I am the head of the Alternative Crisis Response Unit. I'm joined by Elon Schultz, the Chief of Policy and Strategy, and Latina
Mr.
Jackson,
Wilson?
the
Mr.
Deputy
Wilson,
Director.
could you bring the microphone
Oh,
closer
sorry.
to you? Yeah, it's hard to hear.
Yes,
Deputy
close as you
Direct-
can. Thank you.
Okay. Latina Jackson, Deputy Director of Countywide Engagement. I just want to start by saying I'm delighted to be back at City Hall today. I spent 9 years working here as a member of Mayor Garcetti's Office of Public Safety, 1 year as Deputy Mayor, and it's here that I really began on building systems that would shift calls away from law enforcement when they have better alternatives available. I think that, no more is this true than calls involving mental health crisis. We know that there's been a large jump in calls to 911 over the recent years for people that are involved, have mental illness. And, unfortunately, we've seen an increase in officer-involved shootings where the victim was suffering from a behavioral health crisis. I've seen officers frustrated with not having the expertise and experience to deal with mental health issues where they didn't feel qualified to deal with. But, I think together we do have the expertise to approach these incidents differently. We can provide better outcomes for residents in crisis. So 2 years ago, I was fortunate to have the opportunity to move to DMH and really help build a new comprehensive system for addressing mental health crisis in the community and really effectively shift the responsibility for crisis calls away from law enforcement and, away from law enforcement and to be handled in the mental health care system. So our goal with ACR is to leverage the expertise that DMH has in crisis response into a countywide 24/7 field operation that can quickly respond to individuals in crisis. So, our belief is that if we can build a 24/7 system with capacity and provide timely responses, then we can give the public a real alternative to calling law enforcement when they're faced with a crisis situation. I think that Basically, this began as a board motion in 2020. DMH was given official responsibility for implementing ACR throughout Los Angeles County in 2022, and we stood up a dedicated ACR unit in 2023. We've expanded over the last 2 years. We've expanded our teams. We've had to have 24/7 availability of teams throughout the county, and we've more than doubled the number of field operation teams that we have in the county. You know, I think a lot of the components of this system, you know, the helpline, PMRT, the urgent care centers have been in existence for many years, but really over the last 3 years, you know, the county and DMH have really put their focus into scaling this operation up so that, you know, we ensure that we have a continuum, you know, a timely continuum of care for people who are in crisis. So our continuum of care is broken down into 4 pieces. When someone's having a behavioral health crisis, we first want to ensure that they have someone to contact. We want to direct them to 988 or our 24/7 helpline as the entry points for crisis services. Next, we want to ensure that we have someone to respond, and as I mentioned, 24/7 crisis response teams in the field. And then having somewhere to go, we want to ensure that we have enough hospital beds and that we're leveraging alternatives to hospitalization wherever possible, like psychiatric urgent care centers or crisis stabilization units. You know, those are important alternatives that we want to keep building upon and expanding as hospital beds are short. And then finally, someplace to be treated. We really want to make sure that after the crisis, we are following up with each and every individual to make sure that they're connected to long-term care and treatment and hopefully prevent the next crisis situation from happening. So just an overview of our 988 system. 988 is a national phone number for mental health support. And in Los Angeles County, we've contracted with the D.D. Hirsch Mental Health Services to operate our 988 center in LA. They respond 24/7 to calls, texts, chats, anyone who needs any kind of support for suicide, mental health, substance use crisis, they can call that number. And importantly, if D.D. Hirsch is not able to resolve those calls over the phone, they can connect those callers with DMH for an in-person field response. The other important thing about 988 is that LAPD has been diverting calls to the 988 system through D.D. Hirsch since 2021. They're one of the first police departments to begin, you know, this system of diverting 911 calls directly to the 988 system. So really this enables PSRs who have 911 calls that are mental health related to transfer them over to 988 to be handled in the mental health system. And as I mentioned, calls that are not resolved over the phone, they can be referred to DMH field intervention teams for an in-person response. We are using this as a countywide model. The system that LAPD has developed, we're expanding it to other departments throughout the county. The Sheriff's Department is starting to pilot it now, and we're, you know, hoping that that could be a model for countywide diversion of 911 calls. Here, I've got statistics on what the volume of 911 calls that LAPD has diverted to our 988 system over the last 2 years. You can see it's pretty stable across the last 2 years, around 150 calls a month. So I think that's a pretty low number, you know, given that we have 21 divisions. I think that's an area that we must continue to work with LAPD to encourage PSRs to transfer more mental health related calls over to 988. You know, I think we need to give them more comfort in transferring the calls. I think a lot of times PSRs feel like it's safer to just keep a call with 911 and deploy a patrol officer rather than sending it over to 988. And so that's something that we want to continually work with them on. One of the things we noticed that in the last year, we did not see a drop-off in referrals over to 988 with the, you know, with the launch of the UMCR program. So it's not really taking away from calls that would otherwise be sent to 988. Really, these two programs are both providing alternatives for 988, for 911 PSRs to be able to, you know, to divert a call to. So really we have a no wrong door approach. You know, if people can call 988 for in-person support, they get about 6,400 calls a month. 93% of the calls to 988 are first person, meaning people who are calling on behalf of themselves. And then about 96% of those calls are safely resolved over the phone. And then we also have our DMH 24/7 helpline access. They receive about 5,600 calls a month. They operate a little bit differently. Overwhelming percentage of those callers are people who are calling for a loved one, family members, loved ones who are calling on behalf of someone else. We deploy a field intervention team to about 45% of those calls. And last month, we deployed our FIT teams to about a little over 2,000 calls. And so that's, you can see that both of these numbers operate a little bit differently, but they're both, kind of important resources together, generating about 11 to 12,000 crisis calls per month. What's important to note that these are connected. So regardless of what number you call, if an in-person response is needed, a field team can be dispatched to that person's location. I'm going to show you a short video on the process of someone calling for help. This is part of an overall media campaign that we just launched to raise public awareness and trust in our field intervention teams.
We're the crisis response team from the Department of Mental Health, a crew of mental health clinicians and community health workers, specially trained to arrive at your side with compassion and expertise. We're LA's first responders for mental health crisis support. You can request our help anytime, day or night, for yourself or others, and we'll come directly to you, wherever you are in LA, at home, school, work, or even in the park. We can offer support for any kind of mental health crisis, from the chaotic scene of a schizophrenic break or panic attack, to helping someone who may be withdrawn or isolated due to self-harm or suicidal thoughts. When we arrive, we'll speak with the person's loved ones to address any risks or needs. Then we'll meet the person who is in crisis to better understand what they're experiencing. Our initial goal is always de-escalation. We want people to feel seen and heard without judgment and to bring calm and clarity to the situation as much as possible. We'll assess what kind of care the person needs and determine the next best steps to keeping them safe. This could be a visit to psychiatric urgent care or a recommendation for social services. Sometimes involuntary hospitalization may be necessary. We know it can be scary to reach out for help, but that's exactly what our team is trained to do. To be with you in moments of mental health crisis, to help you and your loved ones to potentially avoid negative encounters with police. We're dedicated to offering a kinder, more empathetic response, and that's why you should call us first. Dial 800-854-7771 for our 24/7 helpline.
So as I mentioned, we have about 70, that's not
That's perfect. That's
there you go.
perfect. Yeah, I can hear you. That's great.
We have over 70 field intervention teams in the field now. These intervention teams, they provide crisis intervention in the individual's location, whether it's school or home or on the street. They evaluate the individual for hospitalization and conduct safety planning. About 44% of our dispatches end up with a 5150 or 5585 hold for the individual. We'll educate and support the family members. We'll arrange for transportation to a hospital or another least restrictive setting of care. And then referrals and linkages. It's really important to make sure that people are connected to ongoing mental health treatment in our system. Our teams are comprised of a community health worker and a clinician. The clinician types we have are psychologists, nurses, social workers, licensed psych techs, and they provide that associated clinical expertise. The community health workers often are peers with lived experience, providing a community connection for the individual. And so that collaboration works really well in making sure that you have the clinical expertise plus somebody who can help talk to them and help get somebody to open up in that situation.
What I like to call book smart and street smart.
That's right. That's right. So we have a bunch of different team models, way too many acronyms that I'm comfortable with, but I'll mention these really quickly. The main one you're familiar with is our PMRT, our Psychiatric Mobile Response Teams. Again, that's a clinician plus a peer. We have mobile crisis outreach teams, which is the same model, but they're contracted teams who help support us with coverage after hours, overnight, holidays, weekends. And then we have our therapeutic transport teams, and that's the same model, but they also include a clinical driver. And the driver can help transport the clients to another destination, which is great because you don't necessarily have to wait for an ambulance in every situation. So we We have a few of those teams. So all three of those team models, they're responding to calls that come in through our 988 or our, our access call center. Then you have calls that come in through 911, and obviously those are going to go to a patrol officer. But we have about 97 clinicians that are paired with law enforcement teams throughout the county. Probably nearly every police department in the county has, some law enforcement teams. So in Los Angeles, the SMART team is comprised of a DMH clinician paired with an LAPD officer. And so when the initial patrol officers respond on scene, if they determine that it's a mental health call and they need support they'll call the SMART team in to come in and provide additional support. Those law enforcement teams can also call a PMRT team if there's not a safety risk at issue, so it just depends on what type of resource the law enforcement teams need. So I want to make sure, like, LAPD patrol officer isn't limited to just calling SMART. They can call any one of our teams to come and help them in the field. In terms of somewhere to go, we have multiple 24/7 destinations to improve client outcomes. The one I really want to emphasize is the psychiatric urgent care centers. We have 9 of them in the county. I think 4 of them are in the city, with another one that's just outside the city. And so these provide short-term stabilization for clients for a stay of under 24 hours. These can be a little bit more relaxed, a less clinical setting than a hospital, and they can be, have an assessment for their issues, and oftentimes clients are out of medication. They can help, get a refill of their medication for them. And so, this is an important resource. These are all available 24/7. They're all available on a walk-in basis, so you don't necessarily need a PMRT team to take you there. If you have a loved one and you can safely transport them to an urgent care center, this is a great, a great resource for those individuals as well. Next, we have our crisis residential treatment programs. We're rapidly growing those. We now have 19, with 2 more coming online in the next couple of months. And those are for longer term care. So we would, we work with our hospitals and our UCCs to refer people to those kind of programs for a longer term period of care in a crisis residential treatment program. And then our inpatient facilities, we have 40 hospitals that we work with to place individuals who have been placed on a hold. And again, those holds are for up to 72 hours. So as I mentioned, psychiatric urgent care centers are a great alternative to waiting for a fit team. Often repetitive and high utilizers can utilize these services. Individuals with co-occurring substance use and mental health issues, individuals needing medication, really a very wide range of services available for people at the UCCs.
And just to confirm, these urgent care centers are some of the places that our unarmed crisis response team for the city sometimes takes our folks, right?
Absolutely.
Okay.
The unarmed teams, law enforcement, paramedics, all of them are able to transport clients to the UCCs.
Great, thank you.
On this slide, I've just given you a list of all of the different UCCs, and I've highlighted the ones that are in the city for you as well, along with their hours of operation, what ages they take. I think most of them take adolescents now too. So in terms of metrics, calls to our 988 and helpline both rose 25% in the last year. Our teams were dispatched to 21,000 calls last year. That's a 35% increase over the previous year. Last year, we hired 23 new teams. We had 40,000 visits to our urgent care centers. And as I mentioned, 44% of our dispatches result in a 5150 hold. We've now hired 8 follow-up teams, so there's one in each service area that they're tasked with making sure that every crisis client seen by one of our field intervention teams does get a follow-up call and is, we make attempts to connect them to longer-term service. We're also building, urgent appointment services so that, urgent appointment scheduling. So our teams in the field can schedule somebody an appointment right then and there. So there's no waiting, there's no, to get a call back to schedule an appointment. Our teams can do it in the field. And so that's now available in service areas 2 and 3. And that'll be expanded countywide by the end of the year. So here's some metrics on our fit dispatches. These are the number of calls that our teams are deployed to in the community. You can see we've had a sustained growth in the number of calls that we've dispatched our field teams in over the last 2 years. I think from comparing 24 to 2023, every month 500 more calls than the previous year. And so we're really encouraged by that. I think it shows a lot of growing familiarity from the public with the mental health resources that are available, as well as just better trust. I feel like as we've improved the capacity and speed of our teams, I think people are much more willing to wait for a PMRT field team to come to them in the field rather than calling 911. So we're still seeing that growth this year. You know, I think we're kind of at a high point in terms of number of calls in a month. So in terms of crisis response in the city of Los Angeles, we have, you know, our FIT teams can deploy countywide, with the exception of Service Area 1 for the Antelope Valley. Those teams are kind of located there, but every other team throughout the county is, you know, available to deploy to any calls anywhere in the county, including the city. But we have 4 PMRT service area offices in the city, in service areas 2, 4, 5, and 6. And so our teams are, you know, located there. They'll deploy from those offices. I mentioned earlier that we had contracted after-hours service providers, and those are Sycamores and Vista Del Mar, providing services for the city. I want to note 57% of our FIT dispatches are to incidents within the city of LA. And then in terms of our SMART teams, we have 26 DMH clinicians paired with LAPD on SMART teams. We have about 14 vacancies that need to be filled. So overall, we've budgeted 40 items for clinicians to pair with LAPD SMART teams. And last year, SMART was deployed to 4,620 incidents and placed 2,758 5150 holds. Here's a view of our response times over the last 2 years. So since January 2023, we've reduced response times by more than 70%, with a 1-hour reduction in 2024 alone. You know, you can see at the beginning of this, we had response times over 5 hours. You know, at that time, we didn't have a 24-hour system. Callers might have to wait overnight for a response. So in 2023, we conducted some really aggressive hiring with the addition of financial bonuses and incentives. We leveraged the county's declaration on homelessness to expedite the hiring process, and we hired nearly 50 additional people during that time period. And so that really bolstered our capacity, and we were able to achieve 24-hour coverage in December 2023. I think that being able to get that 24/7 coverage is really a game changer from our program. There really aren't a lot of crisis response programs in the country that have a 24/7 presence, definitely not any of the size and scope of LA County. And it really makes a big difference for clients. You know, before, if they called at night and a team wasn't available, they'd have to wait until the next morning for a team to come. And so now we're really, being able to respond in real time to those needs. And it's reducing the need for people to probably call 911 instead. They're much more willing to wait for a field team. We've seen a sharp drop in the percent of calls that are canceled by residents as well. So right now, our average response times are in the 1 to 2 hour range. Most of the time, our response is around 30 to 45 minutes. The trouble is we have certain pockets of the day and the week where we're just beyond capacity, and the calls have to wait for several hours. And so we're really trying to address that with focused hiring, especially on our swing shifts and overnight shifts. We had a little uptick in January. A lot of our field intervention teams were redeployed to provide support for wildfire recovery response, and so that kind of affected our capacity during January. But I think we're pretty hopeful that we can continue this trend of reducing response times over the next year. So we are authorized to expand our teams, with more teams expected to come in the next fiscal year. I should note we've had some really significant hiring challenges just due to a national shortage of mental health workers. And this work is really, it's not easy work. It's 100% field-based. They're in the field for their full shift. The hours of operation are tough. The demands of the job are really challenging. It's a challenging work environment. Our teams are going into unexpected situations, unarmed, at all hours of the day and night. And so it's tough to find clinicians who are really, passionate about this type of work. But, we're really trying to do that. We've implemented a lot of bonuses for recruitment and retention, field bonuses for staff that work in the field, shift differentials for people that work overnight. And so we're really hopeful that these kind of incentives are going to help us with our recruiting efforts. And we're also very busy on implementing technology changes to modernize our call system. That's going to improve our scheduling and dispatch processes too. So building capacity and then just improving our systems is how we're really approaching the reduction in response times. I wanted to show you, as I noted, we just launched a media campaign to raise awareness of our FIT teams. This is a piece that we've displayed mainly with metro and bus shelters and train cars to really help people spot signs of a mental health crisis and really know, hey, call us, don't automatically reach for police. And then, so in that middle section, you see the, kind of what are the signs of somebody who's in a crisis. And then down below, we've distinguished, well, how do you distinguish that from somebody who's homeless, who doesn't seem like they're in immediate crisis, but they need help. And we want to refer them to our homeless services. And then finally, we want to make sure that people know if somebody's threatening or if they need medical attention, that's the time. You want to reserve those calls for 911. And then here's another advertisement that we're running in connection with this campaign. This is running on streaming platforms and online. Sound? No sound? No? Okay. Well, all these videos are available on our website, and I'm happy to send you guys links to all of them as well. Can we go to the next slide? Oh, I have the control. I'm sorry. There we go. Okay, so I want to shift now to talk about our partnerships with the city's unarmed response programs. First, I want to frame the way we've approached, crisis response and how we are considering. This really was the model for how we structured our alternative crisis system based on the level of risk involved. And so you'll see over at the top, we in the red, we consider those immediate threats to public safety. A crime is involved. That's what we consider level 4, and obviously those are going to be calls that are referred to law enforcement, and then in some cases a co-response team. And then the next section is ones we consider moderate risk. Number 3, callers that need help in person, but the public is not in immediate danger. That's where we would send our field intervention teams. And then number 2, caller needs help via call, text, or chat. Those are the calls that we would refer to our 988 systems or to our helpline for emotional support. And then finally, level 1, these are situations where there's no immediate crisis involved, there's no immediate risk of safety to anyone, but the caller needs supportive services. And so, that's really where we see, the city programs really being able to play an important role. Our piece is really helping with behavioral health crisis, but it has to be complementary with the broader efforts of alternatives to policing and unarmed response. We're often approached by cities who want to set up their own crisis teams, and rather than duplicating our efforts, we're really steering them towards taking these lower risk calls where social services are needed and don't likely need evaluation for hospitalization. I think that the city's UMCR and Circle programs are really great examples of that. They're handling calls that don't need to go to the police, but don't necessarily need a DMH crisis team either. And when they do encounter someone needing a higher level of care, we're making sure that they're connected with us so that we can quickly send a FIT team. So we're functioning in a complementary way. I think the data bears this out. Less than 1% of UMCR's calls are referred to a FIT unit. So I think that tells us that we're really serving distinct needs in the community. And so together, we're really broadening our reach and reaching more people who are in need. So in terms of working with the city's unarmed response programs, we have biweekly meetings with UMCR and Circle that we've had over the last year, and just really trying to work together in building these programs and kind of cooperating in how they're developed. We've conducted lots of training sessions and technical support for all of the field personnel involved in UMCR and Circle. We've also been participating in a working group with LAPD, SMART, the CAO's office, the mayor's office, and D.D. Hirsch. And I really like this program because this working group, because we're strategically planning how mental health calls, 911 calls are fielded and routed to the appropriate resource. And so we're working together to think about what's the future state of this system and how do we make sure that all of these calls are routed to the right resource in the most efficient way. We've worked with them on the development of the divisional orders relating to 988 and Circle and UMCR as well. And so this really gives us an opportunity to work with each of the, kind of the programs, but also with the PSRs who are actually answering the phones. And so we can understand, like, what are the issues that they're seeing when they get calls. And then finally, we've developed an MOU between DMH and the city to ensure partnership and coordination, in the implementation of these unarmed response programs. Beyond this, I mean, we have a very close relationship with LAPD. We've worked together to build a best practices playbook that talks about how law enforcement should act in the field when they encounter someone with mental health crisis. How do they leverage our teams? How do our teams operate? When's the best time to call law enforcement? How do we get their support in the field? So a lot of working relationships with the departments on how to really strengthen and improve these programs. This just is a really quick overview of how our Circle and UMCR teams may request fit priority support to call our DMH helpline. They've been given a priority line phone number so that they can request a field intervention team, and then our agents will deploy a team. We mark them as level 1, highest priority, so when our fit teams are available, they usually will take those calls first before lower priority calls. We've provided sort of this guidelines for the Circle and UMCR teams so they would understand what types of crises are appropriate for a fit referral, what types of crises you really want to call 911 and potentially get a SMART team involved, and then what are the types of routine calls that you can call our access line for help. Maybe it's a referral to a mental health service provider or an appointment, with an urgent appointment in our system. So, and then we also provided these questions that can assist them in deciding what the appropriate referral is. If somebody's in immediate danger, we want them to contact 911. If somebody's making statements or acting in a way that could get themselves hurt, then that's probably an appropriate place for a fit team or transporting the client to a UCC. If they're out of medication, UCC is a good option for them. And then if the person just needs support or an appointment or is just struggling with mental health concerns, refer them to 988 or the DMH helpline. Finally, we developed this graphic in partnership with LAPD and the fire department and others. We printed this card on wallet-sized cards and bookmarks to help guide the public and remind them of the different mental health services that exist as alternatives to 911. Our goal is to have these distributed widely to field workers throughout the county and make sure people, it's just a reminder for people to understand that, when they are having, mental health needs, there is mental health resources and in-person support 24/7. We just got an agreement with the LA City Libraries to place these in all 70 of their branches. And so really I'm hoping to work with LAPD and fire to get these into the hands of patrol officers and paramedics so when they encounter people in the field that they can give them a quick resource that helps identify mental health support.
Thank you, and if we can, our recreation centers as well.
Yeah, absolutely. Would love to do that as well.
Thank you.
Okay, I think that's it. I'm happy to take any questions you guys might have.
Great, thank you so much. Thank you for that very informative presentation and giving us a lot of updates and information. I'm going to open up to my colleagues first if they have any questions, and then I'll tap in. Go ahead, Councilmember Price.
Thank you for the excellent presentation, for the work and for the commitment that you all are doing to this work. and to the services that you're providing, city and county. It really does make a difference. You mentioned the issue of pay, or maybe you didn't mention that. I'm just curious. Pay and benefits. You mentioned the issue about recruiting. I think it was employing. So talk about wages, benefits, the role that that has in recruiting and.
I think I think the county pays, really competitive, wages and benefits. I think what we want to do, though, is really try to draw people to the field programs, especially, and making sure that there are special incentives available for people that do crisis work, that go into the field. I think that makes the difference. I think there's lots of options for clinicians in the field, in the private sector and with DMH, but I think, really being able to kind of draw them in to do field work is really what we want to focus on.
So you find recruiting then pretty easy, or it's a difficult task, or what are the challenges?
It's been exceptionally difficult. It's hard to get people to apply.
Even with the good county pay?
Yeah, it's been tough. Yeah.
Yeah.
It's hard to get people to apply, and then even if they apply to interview, with the field programs, it's been a challenge.
So what techniques or strategies have you worked out with some of the other partners, LA City and some other agencies? Just curious, any strategies emerged in terms of recruiting or?
Yeah, I mean, one of the things I want to do is just have more sessions where we can introduce our teams to the public. I think, we've worked with LAPD on that before. We're holding a meet and greet session on May 1st where we're going to bring our field intervention team clinicians, our SMART team clinicians together to talk to members of the public and talk about what they do and share their experiences and try to, encourage people to apply for these programs. And so that was really, we held one about a year ago. It was really successful. We had over 100 candidates attend that meeting. And so I think that, just being able to talk one-on-one with people that work on our field teams is really, a successful strategy. Beyond that, we're trying to advertise on social media and trying to, just get the word out.
Get the word out, yeah.
I think just having the general public more familiar with the programs that we have to offer is also going to help with our recruiting.
Yeah, I think exposure is going to be important, and just recognizing that these are career opportunities, job opportunities, professional skills that can be utilized in a variety of ways. One quick question, Madam Chair. You mentioned that DMH employees are embedded with law enforcement officers. Given the current fear that we're hearing from the undocumented community, have you noticed any change in the amount of calls you're getting or that you're responding to?
Can you answer that? I'm not sure.
Do you mean calls for services?
Yeah, call for
from
services,
the
just calls for
undocumented
concern, just calls for help, or calls for, what do we do now?
Yeah, I'm not certain whether there's been a diminished amount of, calls from individuals that are, undocumented. We certainly are seeing in our larger system, individuals react with a greater degree of fear and concern about, receiving public assistance and what does that mean if they're presenting in an outpatient setting and that type of thing. And I guess my guess is that in the realm of alternative crisis response, when someone is having a mental health crisis, there's always been reservation for people to call to ask for intervention, whether it's from law enforcement or from us, and that's the importance of this, this campaign. There's always been reluctance about what the outcome of that will be. Will there be adverse consequences? And I think the ante has just been up now. Like, what does that mean beyond the mental health crisis itself, and potentially, being placed in a hospital involuntarily. But what does that mean for my documentation status and whether or not that will be uncovered, and all of the rumination that goes with that.
Yeah. Well, I just think we have to be sensitive to these issues, and we have to make sure that we are alleviating the concerns and fears that folks have about not being able to receive services and about being picked up unconstitutionally.
Yes.
Right. Thank you. Thank you, Madam Chair.
Thank you, Councilmember. And if I could just uplift the conversation around the workforce, right? My colleague and the co-chair of this committee, Councilmember Bloomfield, we're both co-chairs here. He just put in a motion today that we voted on to move forward around trying to build up that workforce. What I want to highlight for my colleagues here is that you all started your journey several years ago, right? And at that time, if my memory serves me right, Supervisor Barger was one putting motions forward to try to increase this workforce. And I'm sure she had other board supervisors on board with her. I just remember her and her Justice Deputy being leads on this, talking about the incentives, the better hiring, the different scheduling. So you have a few years ahead of us on this, and that's why we've included you in the amendment, so that we can see and learn from it, because adding, how many new teams did you say you added last year?
72? 72.
That's a big deal. I remember when 72 was all the teams that we had for a long time. So to grow that in 1 year is incredible. And so I do want to say that I attribute that a lot to the work that you've been doing for years to try to incentivize people coming into this workforce and making it a more, a job that's workable, right? Like not 4 12-hour days, but instead of like a regular schedule, and even incentivizing people working at night. So I think that's important to highlight, because 72 is incredible to grow in 1 year. Chairman?
Thank you. Really appreciate the presentation, and actually I was very, very happy to see the slide about the how you're working closely with the city's unarmed response program. So I was going to ask a lot of questions about that, and you've answered a number of them. But help me understand, but you said something interesting, that you encourage most cities to just go with the lowest level of the 988. But obviously, the City of LA is stepping up with our UMCR and Circle, et cetera. How do you distinguish what the city does from what the county does? If you had to sort of put it in a frame for the layperson who might just see all of them as similar.
You know, I think that the main distinction is that our teams have the authorization to place somebody on a 5150 hold, so they can actually hospitalize somebody involuntarily. And so that's a tool that, you know, that the unarmed response programs, they're not dealing with clients that are at that level of severity of illness. So that's where we can step in and provide support. So I think in terms of mental illness, you know, it's probably lower level mental illness issues that can be resolved in the field by UMCR. It's when, you know, it rises to the level where they don't know what to do with that client and they think this might be something that requires hospitalization, then they can escalate it for one of our teams to help with.
But in terms of, I mean, if there's if a 911 operator or a PSR gets a call, someone's having a mental health crisis, how do they know whether to send it to you or to UMCR?
I think, you know, I think that's a good question. I think that's something that we're working through with the PSRs. You know, we want to, if it's something that can be, if it's something that might be resolvable over the phone, we can have them, you know, refer to 988 and have them talk to a crisis counselor. If the PSR feels like they need to send somebody immediate, then they would, you know, refer the call to UMCR.
Well, or ARC, right? I mean, how do you?
Or to one of our.
But how do they choose between the two?
How do they choose between UMCR?
Between the county and the city, essentially.
You know, I think it's up to the PSR, honestly. We don't really have any good guidelines in terms of that. I think, you know, the higher level of care calls, you know, if the PSR would transfer it to DMH.
Right. And I guess if you're not in the city of LA, then there's no choice, then it just goes to you.
It would just come to us, yeah, that's right.
Okay. And then your funding, how are you all funded? Is it Prop 1 or is it general fund?
So I think through MHSA and through Medicaid. Medi-Cal.
So through Medi-Cal reimbursement?
Yes.
Yes.
And that maybe that's another difference as well?
Yes.
In terms of the funding?
Mm-hmm.
So you get federal reimbursement?
From the state.
And state
federal,
reimbursement?
yes. Mm-hmm.
Yes.
Federal and state.
Yeah. Is there general fund money that's put into ARC at all?
I don't believe so. No.
Okay. That's another difference.
Yeah, just to further explain, excuse me.
Elon, a little closer, please. Thank you.
Elon Schultz, Chief of policy and strategy for DMH. Just to further explain, council member, one of the other differences between the city and the county DMH is that DMH is responsible for providing specialty mental health care under Medi-Cal. That's actually a agreement and contract that we have with the state. So any Medi-Cal reimbursable services have to be either delivered directly by DMH or contracted through DMH. And in this case, crisis services are a new benefit, relatively new benefit under Medi-Cal. So we are able to receive some reimbursement for some of the ACR services. But as Mr. Wilson said, we have other funding sources, including MHSA, which is also known as Prop 63, which is being revised by Prop 1. We use our MHSA resources and some grant funds as well.
Right. I'm just thinking, from a regional financial perspective, it would behoove us to have as many calls as possible go to a reimbursable account versus a non-reimbursable account, and to figure out in some ways that being part of the mix in terms of how we make these decisions, right? About
And-
where to send the call.
Yeah, understood and agreed. The critical factor here would be if the call response is deemed to be medically necessary under Medi-Cal. If it was, then of course, it's both an entitled benefit for the client. So that client has legal access to that response service. And like you said, it would also help us leverage outside dollars on a regional basis.
But how do you, I mean, when you get the call, you're not going to know that, right? You get a call saying someone's suicidal, or someone is having a mental health crisis, or is acting irrationally in the middle of the street, you know, all those kinds of things, or just needs a welfare check. All those things could rise to that reimbursable description that you said, right?
I don't know all the specifics well enough to give you a clear answer, but I would say that not necessarily all of those. For example, a welfare check may not rise to the level of an acute mental health crisis that would therefore be reimbursable. But I don't know if my colleagues have different take on it.
Yeah, Latina Jackson, Deputy with Countywide Engagement Division. So I would agree with my colleague, Ilan, that a welfare check wouldn't rise to that level. And I think, you know, the way that this works is very similar to my area in the department. Really has to, my area of oversight really is around homeless longitudinal services. It's not the crisis response end of what we do. But we coordinate with the larger countywide homeless coordinated outreach response, and I would say it's very much in the same way that our colleagues that are part of the multidisciplinary teams or the LASAHET teams really are kind of the first line of assessment. The MDT teams have clinicians on their teams in the same way that the UMCRs have mental health professionals that kind of assess whether or not this is something that they can resolve readily, that they're in front of that individual, or whether or not this is going to require specialized care because the person is in the middle of a psychiatric crisis, or they are chronically experiencing substantial impairment because of their mental illness. And that is when they would call in a specialized team. Now, whether that it's a crisis that, you know, needs hospitalization and that person needs to be assessed immediately, that would certainly be the ACR, you know, component of what the department does. Or if it was a kind of a chronic, sort of requiring longer term treatment and intervention, then that would be, you know, sort of my side of the house.
Thank you.
Thank you, Chairman. I do want, if you could uplift for us, please, but your funding isn't safe, right? Like right now, with the federal administration that we have, a lot of these dollars are on the line. Correct me if I'm wrong.
Sadly, you are not mistaken. Right now, DMH receives about $1.2 billion a year in federal Medicaid dollars. So that's just from the feds. And frankly, right now, 0 to all of it is at risk. You know, as you guys have seen, the Republicans in Congress have various plans to cut the federal budget, including up to $880 billion from Medicaid at a federal level. So we are very unclear as to what can happen to our federal dollars, including the very reimbursements that we're talking about for our ACR services. If we are to experience cuts, they would hit the state first and then hit the counties, but we have no idea at this point how that would play out. In addition, we have, as Mr. Wilson said, we have MHSA that funds ACR, but as I mentioned, we also have grants, and those grants have also been under attack. If you may recall, in January, there was a memo from the White House Office of Management and Budget that said that all federal funds were frozen. That included the grants that we received from the feds for ACR services. Now, thankfully, that OMB memo was overturned and then rescinded, so it didn't go into effect, but it points to another source of funding that we use to support ACR that might be at risk again in the future.
Thank you. And also, please correct me if I'm wrong, but the service providers that we have for our UMCR teams, I know that we have our team here from our city to talk about it if they want, but almost all of them, if not all of them, are tied into the Medi-Cal reimbursement system, right? And so when you have like Penny Lane responding to a call, they are already service providers that pull down Medicaid dollars, and so if they were to do a warm handoff, they could do it to themselves, and I'm sure that they do in cases, or they take them to your urgent care centers. And in both those situations, that's Medi-Cal reimbursable, right? So we're still getting some resources there. Okay, I just wanted to uplift that because I think it's important. And colleagues, are there any other questions? Go ahead, Councilwoman Rahman.
Yeah, just thank you so much for your presentation, and it's nice to meet you in person, Latina.
It's nice to meet you as well.
I just wanted to ask a little bit more about what Councilman Blumenfield was asking about in terms of the integration with the 911 system. So you have stats in here about the number of calls that are diverted from 911 to 988, but, and when 911 calls are taken, you know, PSRs redirect calls to the Circle program, which we fund through the city as well as through the UMCR program. Have you worked with LAPD and the PSRs to kind of teach them how to divert calls to the psychiatric mobile response teams or other kind of emergency mental health services that you're able to provide? And if so, what's been that training and engagement process? And do you know how many calls are diverted to the psychiatric the urgent response teams that you guys fund?
Well, the DD Hirsch has done training for the PSRs on how to divert calls to the 988 system, and so that's...
But that's for like an individual facing, that's not for a crisis call related to like if someone else is experiencing a crisis, you don't call 988, right?
You could, and they could connect them to a mobile field intervention team. So that is a pathway to connect those individuals to an in-person response through 988.
So 988 can actually dispatch the PMRTs?
They don't dispatch them directly, but they will put in a referral to DMH to send a fit team. So we're connected.
Sorry, I can't hear you.
Oh, they don't dispatch directly, but they will contact our access call center to dispatch a field team.
And they'll tell the person who's calling to say they'll send them there, or they'll make a call.
They will transfer the caller to our access call center, and they will arrange for a field team to be deployed to their location.
So the 180 or whatever calls that are transferred, that's including the crisis teams for crisis calls that are referred to PMRTs.
Yeah, I mean, there may be some additional calls where 911, refers somebody directly to our access center. I don't have stats on that and how often that happens.
And then I know you asked this, but I just want to ask again, like what would be the differentiating factor between the UMCR and the PMRTs being called out? It would be that somebody would be would be kind of reaching the point of having a 5150 or involuntary hold?
Yeah, I mean, I think the UMCRs have some specific call criteria that they've worked out with LAPD.
Yes.
Certain incidents that they'll respond to. So anything outside of that, anything that's above, that presents a mental health issue that's above that, then they would refer them to us.
Okay. Oh, and what is the total funding allocated for the programs described here? Or annual budget?
Yeah, I'm not sure. I'd have to get back to you on that.
Like an order of magnitude? No?
No, I don't know. I don't have a good number for that.
Okay. And then finally, I just wanted to ask, like, if it's I know the call response times have gone down significantly, but it's gone down from like 8 hours to 2.5 hours, right? Which is still feels like a fairly long response time.
Yeah.
And do you have a sense of, like, has it just been staffing that has reduced that call time? Are there plans to try and reduce that call time more? Because a 2.5 hour wait time feels like a long time for somebody in crisis.
Yeah, absolutely is. No, we're trying to do a lot of things to bring down the response times. I mean, a lot of it is hiring, but some of it is just procedures, process, and making sure that we have a really a more efficient dispatching system. And so we're currently in the process of some technology upgrades that will improve our processes in that way. And so hopefully, those are coming over the course of this year.
Okay, great. Well, Chair people, I think that there is real opportunity here for us to do more work to integrate our PSRs and the way in which they're calling for support with the work that DMH is already funding, and which could yield, I think, potential changes in the way that we're funding our own programs, if we could kind of delineate better ways in which the PSRs could access these resources more effectively. And I hope that will, thank you so much to all of you for coming here today, and thank you to our chair people for agendizing this, but it feels like this is an area that's really ripe for coordination and further communication. So thank you all.
Thank you.
Thank you. Colleagues, any other questions? Okay, we're gonna close it out. Thank you so much for joining us today, for providing this presentation and information. I agree with my colleague, Councilmember Rahman, that a lot has come up on how we can further and work together and how we can work deeper together. I know that dispatching is something that I've been very interested in, but and y'all have to know, like, when I got into office, our dispatchers were doing forced overtime because of the lack of PSRs that we had.
Yeah.
And so we had to also put motions forward to hire PSRs so that they wouldn't be on forced overtime. And, they've hired a good number. Still, though, when we think about a dynamic dispatching system with the capacity and the support it needs to appropriately direct to different teams, like, we're building that. But I always say that if we don't have a dynamic dispatching system with capacity, it doesn't matter how many teams you have, the right team is not going to get there. And so, however, if there's a way we can work deeper collaboration with that part, I think it would help facilitate, yes, 100% more calls getting to you, more clarity on delineation so we're not overlapping, but also even building the deeper warm handoffs of if the call isn't for our UMCR, but it would be great for a fit, like, just reinforcing that relationship with warm handoff. And so I hope you all just know that we are more than interested in collaborating and supporting and figuring this out so that we can get a good system for our entire city and to work with the county as well. But my deepest gratitude to you all for coming today, and this might not be the last time, this might just be the first time, so I hope that y'all are okay with that. Chairman Blumenfield, anything you'd like to add before we close this meeting out?
No, I think you said it all well. Thank you.
Thank you. Madam Clerk, do we have anything else before us today?
The desk is clear.
Wonderful. I'd like to adjourn this ad hoc committee. Thank you so much. Have a great recess and weekend.
Thank you.
Thank you.
Thank you.